Okay, good day everybody. I am Dr. Fevrier Drigo, District Medical Officer working with the Primary Healthcare team of the Ministry of Health. The Ministry of Health is very interested in this program. As you may well know, primary healthcare is where most patients who have been violated, whether it be a child, a woman, a boy, or a girl, has been violated, they come through the primary healthcare first. Most times it does not go first to the emergency room. They come to one of the clinics where they are dealt with by one of the district medical officers or referred from the welfare division, referred from the police. So it's our prerogative to ensure that these SOPs are properly done so that the 7 healthcare districts, which are what we have in Dominica, that we all work using the same methods. Everybody has a different school of thought usually on how a thing should be done, but in medicine it has to be evidence-based. So when you have an SOP which tells you that this is how it should be done so that it can be done properly and efficiently, and I think that's a good thing for the Ministry of Health. All too often you find discrepancies in the way doctors and nurses and FNPs deal with patients or victims, survivors, what you want to call them, and then it gets to court and you have a very savvy lawyer who will twist your words or change things around, and then a case gets thrown out of the courts. And this little girl may continue to be abused and not want to report because the last time she went through the entire process of getting to the courtroom, and because of one mistake from a doctor who does not know or did not know how to do it well, do it the proper way, then it gets thrown out. So it sort of frustrates the entire system. It frustrates the police, it frustrates the welfare division, it frustrates the clients, the survivors, the victims of abuse. So right now I see this as an all-consuming importance, because I'm one of those persons who's extremely passionate about seeing these court cases go through. So for me, having this SOP written and done is important. UNFPA now wanting to fund something like this and spearline something like this. As you know, we've just gone through Maria, so our attention has been diverted to making this country climate resilient. But you cannot have a climate resilient island without climate resilient people. So when there are foreigners coming in and wanting to prey on the young ladies, prey on the young men, it's up to us now as caregivers to make sure that a workshop like this, which has been set up by UNFPA, that we grasp and we learn and we absorb as much of it as possible, so that God forbid we have another incident like Maria on our hands, we are well able to cope and deal with it.